The little clock on the wall says it's 9 o'clock. It's Saturday morning, and the next 15 minutes you hear on VOB is especially designed for diabetics and pre-diabetics. In today's show, you'll be hearing how diabetes impacts on you as you age.
I'm looking forward to hearing that.
Also, you'll be hearing about another diabetes medication. And an exclusive today, something you've never heard before. You'll be hearing a joke from Dr. Diane Braffic. You don't want to miss that. So make sure and stay tuned for the next 15 minutes with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center to keep you physically healthy, and the bank that is there to keep you financially healthy, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
This is Peter the Voice here. Good morning again. Many thanks to Republic Bank for sponsoring this 15 minutes to tell you all about the services of the Maria Holder Diabetes Center located in Warren, St. Michael. It's September already.
2024 going along quick, yeah.
Did you get your eye screen for diabetic retinopathy yet? Time for you to call and make that appointment. That telephone number coming up soon.
243-3937.
You can also make an appointment to see a podiatrist to get your feet looked at because you know that is very important when you are diabetic, and also get a vascular screening to make sure you don't have any
Bad circulation.
Or you can see dietitian Victoria Cox to make sure you are eating what you should be eating. Or you can see a diabetes specialist doctor like Dr. Diane Braffic, who can check to see the state of your diabetic health. And Dr. Braffic can also tell you a joke. Yes, you know me. So let's go to our first segment of the morning where Dr. Braffic speaks on diabetes and aging and also has a joke for you. Take it away, Dr. D.
So you know we always need that time off for a good joke, a little chuckle. And I have a joke that was sent to me this week. It made me smile. So the doctor said, "Why did you take your antibiotic medicine at 6 p.m. when I told you 9 p.m.? Patient's response, "I wanted to surprise the bacteria." I'm sorry, but I think that's really quite funny, actually.
Don't quit your day job, Dr. D. That was a good one, though.
So remember to take your medication at the time you're meant to take it. There is a reason that it's spaced at specific times. My lady had good intentions in trying to surprise the bacteria and get rid of them. But remember to follow the directions on your medication labels. Okay, so moving on to another topic, which is very important, really. We wanted to talk a bit about diabetes and considerations in the older person, or maybe tips. I'm going to try to get through as many of these as I can, but I realize I could actually do 2 or 3 shows on this topic because there's really a lot to consider when you really get into the details of each point, but we'll try to make it concise. So the first thing we're going to talk about is dietary advice. Do you as an older person need specific dietary advice? Some people may need special diets in addition to the diet that they're being recommended for their diabetes, or they may have digestion issues, or they may have issues with chewing. So dietary advice must always be tailored to you do and what you need specifically, and also your eating preferences. So this is why we always recommend a consultation with a registered dietitian to get a plan that caters to you.
I call in and make an appointment with dietitian Victoria Cox first thing Monday morning, boy.
Number 2, exercise. We know that exercise is a very important part of diabetes management and really is just beneficial for your health. As we get older, our muscles are going to shrink and atrophy. Our bones get weaker. They lose their density, become more prone to fractures and osteoporosis. Our ligaments get tighter. Everything changes as we change and as we age. So exercise can help to reverse some aspects of the aging process on the musculoskeletal system. But above that, it also helps to keep the heart healthier, stronger, will improve your breathing, especially if you have an underlying lung problem or an underlying heart problem. It can be of great help. And then most importantly, of course, exercise does lower the blood sugar independently of insulin. So that exercise, I always tell people that lifestyle, your diet and your exercise is actually the best pill that you can take. And then you see what medications are needed on top of that. Exercise can look quite different. Everybody's not going to be able to walk 5 kilometers, but it can be gardening, it can be dancing, it can be swimming. Maybe you need to do non-weight bearing exercises instead of traditional exercise. Maybe you're in a wheelchair and you feel, but I can't exercise. Sorry, you can exercise. You can do upper body exercises. You can do seated exercises. And the honest truth is right now there is so much on the internet that you can pull down many types of exercise programs, even if it's rehabilitative exercises that might come in the form of Pilates or yoga or something else. Just keep that body moving.
Thank you, Dr. D, for that advice on the importance of keeping your body moving, exercising, so even if you don't get muscles, like this next song coming up, you get to be fit and healthy as we go into our song of the day. This is dedicated to all the Arnold Schwarzeneggerians out there. I've got muscles. This is Diana Ross, and she wants muscles. Compliments the Maria Holder Diabetes Center and Republic Bank. I'll be back.
To always understand, but that's alright for her. Still, it ain't enough for me. She said she wants a guy to keep her satisfied, but that's alright for her. But it ain't enough for me. Said, I don't care if he's young or old. Just make him beautiful. I just want someone I can hold on to. I want my soul.
Book your vascular or ABI screening test today by calling the Maria Holder Diabetes Center 243-3937.
I want my soul.
The Maria Holder Diabetes Center.
They say they have to see his real personality, but that's alright for them. Still, it ain't enough for me. But I need what the eyes can see. Here's another thing. If that's alright for them, still, it ain't enough for me. I don't care if he's young or old. Just make him beautiful. I just want some strong man to hold on to. I want myself. All over his body. Make it strong enough from his head down to his toes. I want myself. All over his body. Make it strong enough from his head down to his toes.
The Maria Holder Diabetes Center.
Happy Saturday once again from us at the Maria Holder Diabetes Center for the Caribbean. We're going to have a quick talk on another medication, and I thought of the term medication matters. However, I've thought of it near to the end of our medication discussion series. But today we're going to talk about gliptins.
This is Lipton's Tea.
Gliptins are a class of medication, tablets used to treat diabetes.
Oh, okay.
And what are some of the common names you may have heard of? The brand names are going to be things like Galvus, Trajenta, Sitagliptin, which is actually Januvia, and the drug names are going to be Galvus is Vildagliptin, Tradjenta is linagliptin, and Januvia is sitagliptin. Some of these medications come in combination with metformin, such as Galvus-Met, and Janumet is the Januvia or sitagliptin in combination with metformin. That just makes it more convenient for you to take both medications. They've actually found that sometimes when you combine metformin with other medications, you have less side effects. So how do these work? Well, the pathway may seem a little complex to some people, but they work through other hormones, such as things called GLP-1, incretins, and glucagon. And the net effect is that it increases insulin secretion when your blood sugar goes up in response to a carbohydrate meal or carbohydrate or sugar intake. So these medications are liked because they are weight neutral and they are actually relatively well tolerated. They do have a few side effects, though, to be honest, in my experience, the majority of people do not have any issues taking them at all. So those side effects will be things such as gastrointestinal upset like nausea, bloating, tummy cramping, or diarrhea, which we don't see very often, flu-like symptoms at the onset of taking it, and more rarely, skin rashes. It may be the typical allergic skin rash, or you may notice purple bumps on the skin. But once again, the side effects are actually not very frequent, but if you have a concern with this medication or any medication you're taking, please discuss with your care provider or your pharmacist. I want to alert people to two very rare but serious side effects, which will be things like pancreatitis, which may manifest as abdominal pain or pain in the back, vomiting. Pancreatitis does cause quite severe symptoms, so it's something that will probably take you to a doctor's office, but isn't very common. And also there is a caution if you have severe heart failure that you need to look at the dose of medication, so you may want to discuss it with your doctor. Some of these medications, the dosage may need to be decreased if you have advanced kidney disease, another thing you want to discuss with your care provider. However, the drug Tradjenta or linagliptin is actually not excreted by the kidney and can be used at its normal dose even if you have end-stage kidney disease. I hope that may be helpful to some of you in some way if you are taking it, being recommended it, or somebody that you care for is using it. Always discuss with your care provider if you have any problems or if you're having some form of intolerance or you're not sure about your medication.
For a long time I was prolonging not to have my eyes, I went to get an eye screening. I checked for a long time. But because of I had a cataract operation 5 years ago at the hospital, and then when they would go to the hospital, because of the amount of people that goes to the clinic there, you don't always get special attention. And just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance, and I can say that I was well satisfied with the result. Right now the cataract is under control. So I would say yes, that is very good. It's very good for diabetics.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center celebrating its 10th anniversary. Until next time,
drink more water. Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it